Okay, y'all, so today I'm going to be talking to y'all about chlamydia. This is one of my nursing things that I've made when I was back in school. I'm on my summer break, and I'm trying to post all these even though nobody really cares for it. I digress. Let's continue. What the crap? Okay, what is chlamydia? Chlamydia is one of the most common sexually transmitted infections, also known as the STI. You can get chlamydia from intercourse, anal sex, or oral. Because chlamydia often doesn't cause symptoms, many people who have it don't know it and unknowingly infect other people. Regular screenings can reduce the chlamydia spread. Um, and let's talk about the image on the left-hand side, how chlamydia affects the body. So these are just a couple things that you may or may not notice. Fevers, nausea, burning during irritation, anal discharge or bleeding, painful or swollen testicles, discharge from penis, vaginal discharge or bleeding, abdominal pain, and inflamed eyelids. I don't know if my voice is very good during this because I don't have a mic right now. I lost it, so I'm sorry. Next, signs and symptoms. Starting on the left-hand side, chlamydia infections spread through sexual contact. When vaginal fluid or semen containing the bacteria that causes chlamydia travels from one person to another. Sexual contact includes all kinds of sex, including sex that doesn't involve penetration or ejaculation. There are lots of ways that the fluid from one person's genitals can transmit the bacteria that causes chlamydia. On the right hand side, chlamydia can be sneaky because you probably won't have any symptoms that you can see or feel. The picture, I got this picture from Lloyd's Pharmacy Online Doctor, so yeah. Now it talks about the different things from a male to a female, so let's talk about them. The female symptoms are pain, burning when you're urinating, unusual, bleeding when you're not on your period, pain in your abdomen and pelvis, and during sex. Now, the males, pain, burning when you're urinating, itchiness or burning in the urethra, testicular pain and swelling, and white, watery, or cloudy penile discharge. Next thing we're going to talk about is risk factors. These are just the main couple. If you're under 25, if you're pregnant, if you're homosexual and are actively having sex, and when you have any partner. Next are testing methods. The most common test for chlamydia is called nucleic acid amplification, which is also known as NAAT. Your provider takes a sample of a fluid by doing a vaginal cervical swab or collecting a urine sample. Then, they send the sample off to a lab to check for bacteria that causes chlamydia. Your provider may do the test in an office, or they may ask you to do an at-home chlamydia test. Follow your provider's instructions carefully to ensure you get the accurate test results. Because most chlamydia cases are asthma-sympathetic, which means you don't have symptoms, I think, it's important to get screened for chlamydia even if you don't notice any signs of infection. Next thing, test treatment options. Oh my lordy. I'm sorry if the text is a little small. Chlamydia can be cleared up with antibiotics in about a week or two, but don't stop taking your medication just because your symptoms improve. Ask your provider about what follow-up is needed to be sure your infection is gone after you finish taking your medication. Chlamydia infection can reoccur. Part of your treatment should also include avoiding sexual activities that could cause you to get reinfected and ensuring that any sexual partners who may be infected also get treatment. You should abstain from sex until your infection has cleared up, contact all sexual partners, get tested for other STIs, HIV, AIDS, syphilis, herpes, or gonorrhea. Curable or manageable? First question is, can chlamydia be treated? Yes, chlamydia can be treated and cured. Some sexually transmitted bacterial infections are starting to become resistant to antibiotics, though, and this makes them harder to treat. With this in mind, the best way to fight chlamydia is to prevent infections from spreading. What happens if it goes untreated? Untreated chlamydia can put your health at risk. Make an appointment with your provider immediately if you notice any symptoms of chlamydia, and get regular STI screenings to avoid complications later. Prevention strategies. The only way to avoid getting chlamydia is to abstain from having vaginal, anal, or oral sex with someone who has chlamydia infection. And be sure that sex toys that carry the bacteria doesn't come into contact with your genitals. Use condoms during intercourse, anal sex, and oral. Don't use use dental dams during oral sex or vagina to vagina contact. Don't share sex toys, but if you do, wash them after each use and cover toys used for penetration with a condom. Have sex with only one partner who only has sex with you. Complications if untreated. So we have affects everyone, just affects females, and just affects males. So females, pelvic inflammatory disease, PDI, pregnancy complications, and infertility. Males, I don't know if I'm saying this right, but epididymis and reduced fertility. Affects everyone. Increase your risk of getting reactive arthritis, which causes your joints to swell and feel painful, and increases your chances of contracting HIV. Okay. Statistics. State chlamydia rate per 100,000. Mississippi. We have 740.1 of our thing. Ours, Mississippi, is one of the worser states. So the dark red is people with the most chlamydia. So as you can see, Mississippi, Louisiana, New Mexico, Alaska, Illinois, New York, Georgia, South Carolina, North Carolina, and Delaware. These are the states that have the most chlamydia per 100,000 people. And these are my 3 sites. I used my clevoandclinic.org. I used chlamydia trachomatis, and I used chlamydia infections. And these are some pictures of chlamydia. And thank you for your attention. Goodbye.